reason that we are flexing the knees is just to make the patient a little bit more comfortable and a little bit more stable. If they are completely on their side without the knee flexed, then hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be demonstrating a general lower body PNF stretching session that you can give to your patients or your clients. Let's say you are a manual therapist or you are a personal trainer and your patient or client is very, very tight in their lower body, and it's just general tightness. There's no one particular area that you notice that there's extreme tightness. This would be a terrific routine that you could do toward the end of a training session or a rehabilitation session. So what I'm going to do for this one, I am going to have Fauna lay down on her back on the table. And this treatment right over here, again, it is a general assessment. So we want to work on all the different areas of the hip, and I'm going to be starting from proximal to distal. So we're going to focus mostly at the hip region. Once we stretch out all the different areas of the hip, then we're going to work distal toward the knees, and you guys will see as I go on with the video. But right now, the leg that I'm going to be treating is going to be the left leg. So if you are treating the left leg, what you want to do is you can have the patient come right to the edge of the table. Ideally, you would want, for this first one, for their feet to be just off the table because it's going to be a little bit easier. But with this one, the first thing that I'm going to be doing is stretching the abductors of the hip. The abductors are the muscles on the side of the hip, so what I'm going to do is bring the leg into adduction. By bringing the leg into adduction, we are going to be stretching the abductors. So you want to walk over until you notice a little bit of restriction in the abductors of the hip. And then once you feel like there's a little bit of restriction, you're going to stop right there, and then you're going to have the patient push into your leg. So right now I'm just going to ask Fauna to push into my leg for 6 seconds. You want them to inhale as they are pushing, and then after 6 seconds has passed, you're going to give them a little tap to signify to exhale and relax. And then you're just going to go deeper into the stretch by bringing them into more adduction. With each of these, you want to go through 3 passes. So again, I'm going to have Fauna inhale and push into my hip. Then after 6 seconds has passed, she's going to exhale, relax, and I'm going to take her deeper into the stretch. And now one final time, she's going to inhale, push. And one of the reasons why I have the foot in this position, her right leg, and exhale, relax, is because by placing her right leg, by elevating it and bringing it into a little bit of adduction, what's going to happen is this is going to stabilize the pelvis and prevent her from rolling over. Now that we have finished the abductors of the hip, next thing you want to do, I'm going to get into the glutes, so the posterior chain, the extensors of the hip. And in order to do that, the first thing that I want to do is have Fauna put the opposite leg underneath both of the stretching straps. So she's going to take her right leg and put it underneath the straps. And ideally, the straps should be above and below the patella or the kneecap. The reason that we are doing this is to help stabilize the limb. When we are taking the hip into extension, what's going to happen is a lot of times this leg will start to raise, and when this leg starts to raise, we end up releasing tension on the gluteus maximus muscle. So by stabilizing it with either a pair of stretching straps or even some stability straps, then this is going to prevent that from occurring. With regard to this, in order to stretch the glute max is responsible for extension, abduction, and external rotation. So we want to do all 3 of those ranges of motion when we're doing it. The first one, what I'm going to do is just go straight extension. So I'm going to take her leg, bring my shoulder as close as possible to the distal portion of the hamstring, and then I'm going to take it into as much extension as I can. And then once I feel a little bit of restriction, I'm going to give her a couple little taps that's going to indicate her to inhale and push into me. Then after 6 seconds has passed, I'm going to have her exhale, relax, and get deeper into the stretch. And then to target the more medial fibers of the gluteus maximus, what I'm going to do is bring the leg into more abduction. So I'm going to bring her leg out a little bit. I'm going to press down. Same thing, I'm going to have her push into me. And then she's going to relax. And I'm going to take it further into extension. And then lastly, to target the more lateral fibers of the gluteus maximus, what I'm going to do is pull her knee across. So I'm going to bring her into adduction. And then from this position right over here, I'm going to, again, flex the hip. And by flexing the hip, we are going to stretch the extensors of the hip. So she's going to give me a little bit of a push. And then she's going to relax and get nice and deep into the stretch. Once we've done the extensors, next thing that we can do is the adductors. For the adductors, we want to keep the leg in this neutral position right over here, and we are just going to take the leg into abduction. By taking the leg into abduction, we are going to be putting the adductors under tension. So we're going to go as far as we can until we notice a little bit of restriction. And the adductors are not tight at all. She does not need this, but if you did have somebody that was really tight, this would be a great one for them. What I'm going to have her do, inhale, push into my hip. After 6 seconds has passed, she's going to exhale and relax, and then I'm going to take it further into abduction. And then the same thing, another time, inhale, push. She's going to push for 6 seconds. After 6 seconds, exhale, relax. Get deeper into the stretch. And one final pass, inhale and push. And then exhale, relax. And that was to stretch the adductors of the hip. The next thing that we want to do is we are going to target the hamstrings. With regard to the hamstrings, we have 3 different hamstring muscles. We have the semimembranosus, which is the most medial. We have the semitendinosus, which is right down the middle. And then we have the biceps femoris, which is the most lateral. In terms of each of these 3, again, we're going to play around with the different positioning of the leg. So for the semitendinosus, because it's straight down the middle, we are going to lift the leg straight up the middle. So for this one right over here, all I'm going to do is you want to stabilize just proximal to the patella. Take the hip into as much flexion as possible. Once they are unable to go any farther, you're going to give a couple taps. Inhale, push your foot down into my hand. Then after 6 seconds has passed, she's going to exhale, relax, and I'm going to take her deeper into hip flexion, putting more tension on the hip extensors. And again, inhale, push, and relax. And we are going to do one final pass, inhale, push. Exhale, relax. Then to stretch the semimembranosus, because it's the most medial, what we want to do is we want to bring the leg into external rotation, and we are going to take the leg again into abduction. This one is very, very similar to the adductor stretch. The only difference is for this one, we are externally rotating the actual femur. By externally rotating, we're going to place a little bit more tension on the semimembranosus as opposed to the adductor muscles. Same thing though, we're going to take her into abduction. Then inhale, push. And exhale, relax. And again, inhale, push. And exhale, relax. Then we are going to do one final pass. Inhale, push. And exhale, relax. And then the last of the hamstring muscles that we are going to be stretching is the biceps femoris. The biceps femoris is the most lateral. So because it's the most lateral, instead of going into internal rotation, we are going to go instead of going into external rotation, we are going to go into internal rotation. And instead of abduction, we are going to go into adduction. So we are just going to take the leg over. Same thing. We want to stabilize just proximal to the patella so that the knee stays nice and straight. And then we're going to go until we feel a little bit of restriction. And for fun, this one of the 3 hamstring muscles, this is the one that's the most tight. So we're going to stop right over here and inhale. She's going to push into my hip. And then exhale, relax, and get deeper into the stretch. And again, inhale, push. And exhale, relax. And then one final time, inhale, push. And exhale, relax. And that is it for the hamstring group, or the extensors of the hip. The next thing that we want to do, that's pretty much it for the actual supine position. Now what we want to do is have the patient turn onto their sides. We're going to get into a sideline position. And now magically we have flipped the table around, but we are still working on the left leg. So what we're going to do right now is we want the knees into a little bit of flexion. The reason that we are flexing the knees is just to make the patient a little bit more comfortable and a little bit more stable. If they are completely on their side without the knee flexed, then they're not going to feel as comfortable. So that's one thing that you can do that will make this a little bit easier on the patient. Now, what we want to do for this first one, we're going to start focusing on the flexors of the hip. Particularly this one right over here, we're going to do the psoas. With regard to the psoas, if you recall, it is responsible for at the pelvis and hip. Anteversion of the pelvis, it is responsible for flexion of the hip, adduction of the hip, and external rotation of the hip. So we want to be able to do all of those in reverse in order to get maximum stretch of the psoas major muscle. So what we're going to do is take the hip into extension, and then she is going to bring her knee forward. So give a couple taps. They're going to inhale and push for 6 seconds. And then exhale and relax. Then if we want to get a little bit of more tension on the psoas major, because it's responsible for adduction, we can bring the leg into abduction. So I'm just going to elevate the knee above the hip. And then inhale, bring your knee down toward the table. And exhale, relax. And then you're going to go more into extension, maintain the extension, and go more into abduction. And then finally, because the psoas major is also responsible for external rotation, we want to take them into internal rotation. So to do that, we want to elevate the ankle above the knee. This one right over here, you don't want to go too extreme because this is a very, very gentle movement. If you go into too much internal rotation, it can place a lot of torque on the knee. So also make sure that you are stabilizing the knee with your hands. And for this one over here, Fauna is going to press her ankle down into my shoulder. And by doing that, she is going to be going into external rotation. And then she is going to exhale, relax. And I am going to take the leg into extension, abduction by standing up, and internal rotation. And right there, we have pretty much maximum stretch of the psoas major muscle. Next, from this position, we can go right into the rectus femoris. For the rectus femoris, it attaches from the AIIS, or the anterior inferior iliac spine, all the way to the patella via the patellar ligament. So what we want to do is take the hip into extension and the knee into flexion to get maximum tension on the rectus femoris muscle. So from this position, I am going to, with my stabilizing hand, stabilize at the ilium by pressing downward, and then I'm going to take the hip into extension. I'm going to have Fauna bring her knee forward into flexion. Then she is going to exhale and relax. I'm going to take the femur into extension. And then because the rectus femoris is also responsible for knee extension, I'm going to take the knee into flexion. So I'm just going to walk close to, try to get her heel as close as possible to her butt. Right here is about as far as she can go right now. So she is going to give me a little bit of a kick and hold that for 6 seconds. Once 6 seconds has passed, then she's going to relax, and I'm going to bring the foot a little bit closer to the butt. And then you can also do a combination of the movements. So she is going to inhale, bring your knee forward, and give me a kick at the same time. And then after 6 seconds, she's going to exhale and relax. I'm going to take the hip into extension, or the femur into extension, and the knee into flexion simultaneously. And this right over here is for the flexors of the hip and the extensors of the knee. Next, from this position over here, we are done in side lying. We can now go into a prone position. So next, the patient is going to lie down on their stomach. And now that the patient is in prone, we can go ahead and get on to the actual rotators of the hip. With regard to the rotators, we're going to be focusing right now on the external rotators of the hip, specifically the piriformis. With regard to this one right over here, we are going to flex the knee to 90 degrees. You are going to wrap your hand over top and stabilize at the medial malleolus of the ankle. Then with your other arm, you are going to stabilize at the sacrum by applying a downward pressure. And what you are going to do is take the leg into internal rotation. By taking the leg into internal rotation, we are stretching the external rotators. And then you are going to give a couple taps, and they are going to press their ankle into your hands. After 6 seconds has passed, they are going to exhale and relax, and you are going to take them further into internal rotation. Then a couple more taps. After 6 seconds, they can exhale, relax. And now one final pass. A couple taps, they're going to inhale, press into the hand. Once 6 seconds has passed, they're going to exhale, relax. And that is it for the internal rotators. Next, what we can do, if we want to target some different fibers, we can bring the knee to the outside a little bit and do the exact same thing. We would do 3 passes in this position, and then you could also take the leg more into abduction and do another 3 passes in that position, but I'm not going to be showing you those because it's going to get very redundant if I go and do all of those different positions. Next, from this position, we already targeted the quadriceps in the sideline position when we did the rectus femoris. However, if we want to get maximum recruitment of the actual vastus medialis, vastus lateralis, and vastus intermedius, what we want to do is do it in a prone position, because this way we eliminate the hip extension. When we do the hip extension, we're targeting a lot more of the rectus femoris muscle. The rectus femoris is the only quadricep muscle that actually crosses the hip. So we want to take the hip out of it. By doing it in prone, we're taking the hip out of it, and we're focusing on just the quadricep muscles that cross the knee. So the vastus medialis, which is the most medial, the vastus lateralis, which is the most lateral, and the vastus intermedius, which is straight down the middle. For this one right over here, we are just going to take their foot, try and bring it toward their butt. Once you find the restriction, couple taps, they're going to inhale, give me a little kick. And then after 6 seconds has passed, they are going to exhale and relax, and you are going to go deeper into the stretch. And we're going to do a second pass. Inhale, push. Exhale, relax. And get deeper into the stretch. And then we are going to do one final pass. Inhale and push. Exhale, stretch. And that covers it for the flexor, or for the extensors of the knee. Next, what we are going to do is have the patient turn back onto their back once again. So Fauna is going to turn onto her back. She's going to keep her knee under the strap. Again, remember, we're starting proximal and working distal. So we already covered the muscles that surround the hip. We already covered the muscles that surround the knee. Now we're going to go distal toward the ankle. At the ankle, to stretch the gastrocnemius, we are going to take the leg into a straight leg, because again, the gastrocnemius, it crosses the knee and it crosses the ankle. It is responsible for flexion of the knee, and it is responsible for plantar flexion of the ankle. So we want to bring the knee into extension, and we want to bring the ankle into dorsiflexion. From this position, what we are going to do, you could just do a couple ways. One would be using the shoulder, and then another way would be you can hold the heel in your palm and use your forearm as the fulcrum to bring it into dorsiflexion. Whichever one is more comfortable, you can do whichever one. Depending on the patient that you have in front of you, if you have a very petite client, then this way would be fine because it's not going to require much effort. If you have somebody that's either very, very muscular or very, very tight, then this would be much more preferable. For me personally, I prefer to do it the shoulder method because a lot of the people that I work with are professional athletes, and they're quite large, some of them, so this is going to be a lot more comfortable for the actual therapist. But what you would do is just give a pull on the heel, and then push with your shoulder forward, and then give a couple taps. They're going to inhale and push, and then they're going to exhale and relax. And then just to show you the other method, if I were to do it with my hand over the heel, my hand's on the heel, cupping the heel, their foot is on my forearm, and then I would stabilize just above the patella, and I would take the knee, or the ankle, into dorsiflexion. Couple taps, inhale, push, and then exhale, relax. And then one final pass, inhale, push, and exhale, relax. That's for the gastrocnemius. Then if we want to target more the soleus, unlike the gastrocnemius, it does not cross the knee. So because it doesn't cross the knee, it is only responsible for plantar flexion. So what we can do for this one is we are going to flex the knee, and by flexing the knee, we are taking the gastrocnemius out of it. And we would do the exact same thing. So we could take the leg into dorsiflexion, inhale, push on the gas, exhale, relax, inhale, push, exhale, relax. And one more time, inhale, push. And exhale, relax. And that is how we stretch the soleus muscle. With regard to the gastrocnemius and the soleus, we can also target different fibers. With regard to the medial fibers, if we want to target the medial fibers, then what we would do is the exact same thing, only we would bring the leg into slight external rotation. And then if we wanted to target more the lateral fibers of the gastrocnemius, what we would do is instead of going into external rotation, we would bring the foot into medial rotation. And that is the way that we could target the medial fibers and the lateral fibers of the gastrocnemius. And then finally, the last thing that we would want to work on is the actual dorsiflexors. So in order to stretch the dorsiflexors, we want to take the foot into plantar flexion. So for this one right over here, a couple ways. One way, you can stabilize proximal to the malleolus, right at the distal end of the tibia with one hand. And then with the other hand, you could wrap it around the foot and take it into plantar flexion. And then you would give a couple taps. They would inhale, bring their toes toward their head. After 6 seconds has passed, exhale, relax, and then you would take them deeper into the stretch. And then another way that you can do this one, this would be beneficial if you have a very, very large client or somebody who's very, very muscular, is you can take both hands and then you could use your body to actually help assist you in the movement. And then you wouldn't be having to use as much muscle. So inhale, bring your toes toward your head. Because in this position right over here, your body is doing all the work, so you don't have to strain yourself. And exhale, relax. So depending on the size of the patient or client that you are treating, that you can play around with the different hand positions and see which one is going to be more comfortable. But that's pretty much it for today's video. This is a general lower body assessment. So if you are a manual therapist or a personal trainer and you have a patient or client that is either very, very tight and it's just general tightness that they have, this would be a great routine that you can do at the end of your actual program with them. But that's pretty much it for today's video. If you enjoyed the video, be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.